Hello and Assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. We are into the final three episodes of this season, and all our success, all our achievements are thanks to you. Our viewers are amazing. Please continue to support us. Please continue to share our work and continue to subscribe to us and sharing our videos. It's been an amazing success. Now, talking about the guest that we have here today, we have Dr. Jason, or better known as the Bloody Tooth Guy. We all know who the Bloody Tooth Guy is, but for those of you who don't know him, I'll give you a brief introduction. Dr. Jason, or better known as the Bloody Tooth Guy, is a maxillofacial surgeon hailing from New York. He did his DDS from the NYU College of Dentistry. He is certified by the American Board of Oral and Maxillofacial Surgeons and the National Dental Board of Anesthesiology. He did his maxillofacial surgery residency program at the Sunny Downstate Medical Center. His belief in the importance of education and training is evident that he dedicates his his residence at the Hackensack University Medical Center and the Beth Israel Medical Center and the Valley Hospital in Ridgewood. He later moved on to the Bergen County, where he has opened his own private practice by the name of Riverside Oral Surgery, from where the name originated of the Bloody Tooth Guy. We'll be talking to him about a lot of things, especially maxillofacial surgery and the importance of a brand name in dentistry. So stay tuned. I hope you like this video. Please share, please subscribe our work. Thank you so much. Without further ado, ladies and gentlemen, Dr. Jason, the Bloody Tooth Guy. Okay, so Dr. Jason, let's talk a bit about you. How about you introduce yourself to our audience? Although I know everyone who wants to be a surgeon already knows you through Instagram, but still tell us a little about your journey through dentistry. When did you decide that you wanted to be a dentist? And those early years, your journey through dental school.
I had a pretty interesting journey. I didn't grow up knowing or thinking I wanted to be a dentist or thinking about dental school at all. I had very good experiences with dentists in my early years. I grew up in the suburbs right outside New York City, and I had a very positive experience with my general dentist, who is like a neighborhood guy, graduated from dental school in 1945. So wow. He was, by the time I was seeing him, I was born in 1973. By the time I was seeing him, he was already well established in his career. He was like in a little home in the neighborhood, and everyone who lived in the neighborhood went to see him, and he was great, and he made a really positive impression on me. And my orthodontist was also somebody who made a very positive impression on me. Yet I still had no clue that I wanted to go to dental school. I ended up in undergrad, which is university, and I became very close friends with a very good friend of mine now, whose father was an orthodontist, and he kind of inspired me to go to dental school. I really had very little guidance in that direction, and I was fortunate enough to be able to do well enough to earn admission into dental school, and the rest is history, as far as my journey into dentistry.
And how were those early years during dental school?
So dental school, I attended NYU. I was at NYU for dental school, which is right in the heart of Manhattan in New York City, which is, my backyard, which is where I grew up. Yeah. So for me, dental school was actually where I got serious. In undergrad, in college, university, whatever, I enjoyed myself a lot. And by the time I was in dental school, it was really time for me to focus and to buckle down. So I was in dental school, and I treated it as an academic endeavor, and as such, my mind was open to learning as much as I possibly could learn.
Perfect.
So I was fortunate enough to kind of happen upon oral surgery. My initial plan when I went to dental school was really to go into cosmetic dentistry. I figured I'd work in the city. I'd be a successful cosmetic dentist, and I'd have a good existence. But once I've tasted oral surgery, I could never go back. And that
absolutely. I can completely understand that. I could completely relate to that. Okay, so let's talk about your early years as a dentist. We all know early years, once you've graduated, are always very tough for a young dentist. So when you were a young dentist and didn't know how to pursue your passion, how were those initial years like? And when did you know, during your undergrad or after your undergrad, that you wanted to be an oral and maxillofacial surgeon?
Okay, so for me, I started dental school, like I said, thinking about cosmetic dentistry.
Mm-hmm.
And I decided in order to do that, the best thing to do was to work for, I worked for a prosthodontist. I was a dental
Okay.
assistant for a
Yeah.
prosthodontist while I was in dental school in the
Wow.
evenings. And that was an eye-opening experience for me. And it actually introduced me to an oral maxillofacial surgeon. So the
Okay.
person who had my job before me ended up going into oral maxillofacial surgery as well. And when
Mm-hmm.
I first met him, I thought he was crazy to do all that extended education.
Yeah.
I actually, I didn't even think of it at all. I was still focused on cosmetic dentistry and maybe pros, but whatever. And so like I said, I found my way into the oral surgery clinic, which was in the basement of NYU.
Mm.
And I met some very influential people in my life, people who influenced me tremendously. And I had the first, like I said, the first taste of oral surgery. And that it started with a dental extraction, which is all I thought oral
Yeah.
surgeons did, exodontia. And from that point on, I was totally in. And I don't know the way it is where you are. I actually did I guess it was a live maybe last week with somebody who is on the oral surgery path in
Yeah.
in Great Britain, and it's different there than it is in the United States. So in the
Yeah.
United States, coming out of so you go to high school, right? You finish high
Yeah.
school 17, 18 years old, and then you move into undergrad, university, general education. For me, it was, and then I went right into dental school. So I was
Yeah.
21 when I finished undergrad, right into
Yeah.
dental school. And then I finished dental school and I went right into oral surgery residency, which
Yeah.
is less common now. I have a 4-year residency program. I'm not a
Mm-hmm.
dual degree oral surgeon, oral maxillofacial. I am an oral maxillofacial surgeon, trained, full scope, board certified, but I don't have my MD.
Okay.
So, which is very standard in the United States.
Yeah.
There's one of two tracks,
Yeah.
and so I found myself at 29 years of age, done with my training and ready to start practicing. So
Mm-hmm.
I was a young man, and I was already fully going.
Yeah. Okay, that's perfect. So in our country, Pakistan, that's basically what's happening. We have a 4-year residency program for oral and maxillofacial surgery, and we are currently working on the dual degree program that is somewhere between 6 to 7 years, and
Right.
that will start somewhere in the near future. So we're working on that. Okay, so my
Oh, nice.
next question to you, sir, is a bit about how we differentiate between maxillofacial surgeons and general dentists. How difficult do you think is the job of a maxillofacial surgeon when compared to a general dentist or any other specialty of dentistry, if there's a difference at all in your opinion?
So, I don't feel that anything honestly is more or less difficult per
Mm-hmm.
se. I think the pathway is more difficult in that it's more competitive and
Yeah,
that the
absolutely.
training is rigorous. And
Mhm.
I believe that the level of what we're taking care of is much more serious
Yeah,
for the most
absolutely.
part. But I don't know that it's more difficult. I think if you have an aptitude, I speak about this all the time. I think if you have an aptitude for something and that happens to match your passion, that I mean, I don't think what I do is difficult at all.
Yeah.
I think it's
You
amazing.
enjoy your work. You
I
enjoy
love
your
my
work.
I
Yeah.
love my work. I love my work. I think probably the most challenging part of what I do is managing people, managing the business of oral
Yeah.
maxillofacial surgery.
Yeah.
Um, Doing the surgery is a pleasure. It's
Hmm.
I have the best surgical assistants. I have the best equipment. I have the best technology in my office, and I've been trained very well. So doing the actual procedures, I love it. I
Absolutely.
I don't find it difficult. Getting to where I am now, that was challenging,
That
but
was challenging.
doing it, not so much at all.
That's an amazing take on it, on the question, actually. Okay,
Thank you.
so tell us a bit about let's talk a bit about your name. I love the name that you have, the Bloody Tooth Guy. It's a completely, innovative name. It's a brand name now. You have your own merchandise, you're quite popular. What helped you come up with this specific name, and how did you build it up as a brand starting from scratch? And just advice to other dentists who want to build their own brand name.
Fair enough. So I'll tell you, when I started Bloody Tooth Guy, this was about 5 years ago, just over 5 years ago. Instagram was, I don't want to say it was in its infancy. It wasn't, but it
Yep.
certainly was not what it is now. And there was
Yep.
very little in the way of dental accounts, very few, very few.
Yep.
And I was quite aware of other successful accounts in other areas of the world,
Yep.
other areas of business and life and culture or whatever. And I've actually, the way I built my practice also was really not focusing on it being, how do I do this vis-a-vis dentistry? It was, what do I see out there? What have I experienced in my life that has brought me to it that I can actually bring to my practice so that people can
Absolutely.
understand? I mean, I practice right outside Manhattan, like I said. So my patient base is a pretty sophisticated patient base. Their exposure to high quality dining and leisure and hospitality
Yep.
industries. In order to succeed in my area, you have to give the patient the experience that
Absolutely.
they deserve. And so I really just kind of did the same thing with Bloody Tooth Guy, and I'll get to the name and all of that. So there was and still is someone named Dr. Pimple Popper, who you may
Yep.
or may not be.
Yep.
So
Absolutely.
Dr. Pimple Popper at that time was very early. It was before her television. She has a television show
Yep.
now, and before her television show. And I just thought it was like, if anyone's going to watch people popping pimples, maybe they would watch. Maybe they would want to see bloody teeth. So I was sitting there in my office with a couple of my people who work with me for me. My partner was there too, my business partner, and I said, I'm gonna start this thing, and I'm naturally a little bit of a marketer. Like I kind
Mm-hmm.
of understand. It's like innate in me.
Mm-hmm.
So I just, to come up with the name, my very close friend, who's like family to me,
Yeah.
has a daughter who at the time was maybe 10 years old, who still had her little stuffed animal from when she was little.
Okay.
And the stuffed animal was called Broken Tail Guy. And it was called Broken Tail Guy because it had a broken tail.
Yep.
So I thought it was beautifully obvious, and I thought the sound of it made sense just in terms of the syllabic,
Yeah.
wake up or whatever. And so Bloody Tooth Guy makes sense. Then
Yep.
that was it. So that was how Bloody Tooth Guy came about. I grew my account really by posting a lot,
Mm-hmm.
and
Yep.
initially I was anonymous. Initially, it was, my personality came through only in what I was writing, and then the stories came, and as
Yeah.
stories came, I was able to, still anonymously, but you heard my voice and you were able to kind of see my existence.
Yeah.
And I think that's how social media uh, accounts grow, by authenticity, by
Yeah.
showing who you
Ab-
are. And
Absolutely.
people who like me and follow me. People who
Yep.
don't, they unfollow me or they never do. And so I think the biggest advice that the number one thing I
Mm-hmm.
always advise people who are looking to start. I wasn't looking to build an account that had 100-something thousand followers or
Yeah.
millions. It was never in my thought. It was, let's see if people are into this kind of stuff. And I think that's
Yeah.
how these things happen. They have to
Absolutely.
be they have to be kind of innocent and organic and real and certainly authentic, and that's what it is for me.
Absolutely. Perfect. Perfectly explained. Okay, so now we're talking about Instagram. You're a pretty Insta famous dentist. You have quite a huge following. You have a fan club. You actually have another account where we talk about you as your fans. So you have a huge fan club on Instagram. What do you think, if I had to ask you, if there was one good thing and one bad thing about being an Instagram famous dentist, what would they be?
So I think for me, this is going to sound like pandering or whatever. But honestly, for me, the best thing is the actual real relationships that have stemmed from the social media, right?
Okay.
So I'm sure you know PNWOMS. Do you know
Yep.
Ben Johnson?
Yep.
So Ben and I have become friends. I mean, he's from Seattle. I'm from
Okay.
New Jersey. Well, live in New Jersey. There would have been no way that we would have met each other
Yep.
in the real world. Yet we share so many common interests and common values, and it really is a beautiful thing. On top of that,
Absolutely.
in the time of COVID, so I have a number of, thankfully, a number of followers all over the world,
Yep.
and so I was speaking on a regular basis to
Yeah.
oral maxillofacial surgeons in Italy. And Italy was hit very hard, as everybody knows. They were hit before we were in the United States, and in the Northeast anyway. And I was I don't want to say getting information. I was understanding what they were going through before any one of my peers in New Jersey were.
Yeah.
So I was able to really take what they were telling me and position myself from a business perspective in a place where I was ready to handle. And I think I don't want to sound like I'm boasting, but we
Yeah.
were leading. We were leading in my area. People, we
Yeah.
were kind of disseminating information
No,
that
that
wasn't
makes sense.
necessarily out there.
Yep. That makes sense.
So,
Absolutely.
so that's the positive. The negative, you know, that's a tough question.
Yeah.
I suppose being under the microscope to some degree,
Hmm.
if you have an ego that's fragile, um, it could be challenging because not all of the feedback, the vast majority of the feedback it's overwhelmingly positive. I get a ton of love all the time, and maybe it's because I'm constantly
Yeah.
appreciative, and I think that yields positivity. But there are guys out there who, for no other reason, will just yield negative, like
Yeah.
the DMs, just negativity. And I'm not talking about surgical technique or anything like that. I'm just whatever people want to give negative. So that is a little negative, but I
Yeah.
think the benefit far outweighs the downside.
Yeah, but that's everywhere. You can't really stop that, and you just have to have a positive attitude in the face of that, right?
That's true. Yes.
Yep. Okay, so my next question is something I'm sure you've been getting a lot lately, something that you've heard a lot about, and it's about the COVID-19 situation currently. We never knew that a pandemic like this would affect our profession more so than any other profession around the globe. So, what do you think the future of dentistry is? How will dentistry change, especially for oral and maxillofacial surgeons? How has the work been affected in America, and what are your future plans as a maxillofacial surgeon?
So we've had to make some pretty significant shifts in our protocols,
Yeah,
uh, but I would say as oral maxillofacial surgeons, we were positioned in a much better position than most of our dental counterparts, right? So we're
yeah,
used to PPE, we're used to
yeah,
operating um, for longer periods of time, gowned
absolutely.
up when you're in the hospital. We understand proper use of PPE, and I think that helps us for sure.
Yeah,
Um, I think that, you know, well before your time, and certainly before my time, there was a big shift with bloodborne pathogens, right?
yeah,
So, before I practiced, people would practice without gloves and certainly without masks. And and then as the time of HIV and hepatitis C was ushered in,
absolutely.
that changed, and everyone was using universal precautions,
Yeah,
assuming that everyone had some sort of bloodborne pathogen, and practicing as such.
yeah,
Now there is more of an awareness of an airborne pathogen. Whether this is a true airborne pathogen or not, there
yeah,
is definitely thinking in those terms. So that is something that will change. I think
yeah,
probably to some degree forever. But I do think that we've already seen. So the Northeast, New York, New Jersey,
yeah,
Connecticut, was hit very hard, very early in the United States.
absolutely.
Very dense population, and that was why. And then we locked down, and we did what we needed to do, and we are in a good position right now. Who
Yeah,
knows what's going to happen a month from now, 2 months, 3 months, whatever. But we're in a very good position, and we're seeing we're seeing that patients are much more accepting of
Yeah,
treatment than they
absolutely.
were 3 weeks ago, 4 weeks ago. So we're now in a very, very good place. My practice, thankfully, is doing well. Obviously, we took a few months off, but
Yeah.
we are back, and we have great protocols. We have great technology. I installed everything I needed to. We protect our team, number one, our patients, number 1.1. And so we are just, you just have to
That's
take the proper
Yep,
precautions.
you just have to take the precautions and it'll run its course eventually. Okay, so this is a question that my team wanted to ask you. Firstly, how did you come up with this idea of introducing merchandise to your to your brand name? And secondly, what's the most unique surgery that you've performed in a dental setting?
Uh, so the merchandise is just because, as this thing grew,
Yeah,
first of all, I have merch, but I don't really push it so much. If
yeah,
you
you
see, like,
don't, you
it's not
never,
like
you, yep, you never pushed
right.
it.
So, I mean, there's no downside. There's really no
Yep,
downside in
absolutely.
capitalizing a little bit on what I've built. So
Yep,
if
absolutely.
people want merch and I can provide it, again, I
Yeah.
don't push it. Nobody, you almost can't find it. And so for me, it was an opportunity. First, I don't know. I like the sweatshirt. That's a cool sweatshirt.
Yeah.
But like that to me is kind of like a secondary offshoot of
Hmm.
what it is. I really don't. I mean, I do have deals with companies and stuff like that now, very
Hmm.
recently, but this was not about that. This was really about just kind of putting the information out there,
Yep.
and it has evolved to somewhat of an educational platform, which I never
Absolutely.
realized that it would be. But it's just another it's just
Hmm.
another offshoot. And the second question was what was
What's the most unique surgery that you
oh
performed in a dental setting?
so my favorite surgery that I have ever done was not in a dental setting. It was in my residency,
Yep.
and well, it was, I suppose, oral dental, whatever.
Yeah.
Was a young boy who was Jamaican. So I trained in Brooklyn,
Yeah.
and there were a lot of West Indian patients,
Hmm.
uh, patients from the Caribbean, and these patients were, they let's say they didn't have much, and they were coming to
Hmm.
Brooklyn, and they were being treated in Brooklyn where they couldn't get treatment in their where the island that they were from. And so this young boy had a fractured condyle, which
Yeah.
ankylosed,
Yeah.
and he was grossly malnourished. He had no ability to open his mouth whatsoever.
Hmm.
His growth was significantly stunted,
Hmm.
and we brought him in. I harvested a rib, and we removed the fused bony segment, and literally he was functioning that day. We fixated
Wow.
the rib, and the kid did amazing. And then, you know after that, I've
Yeah.
had contact with him, not in many years, but there was contact for some time after that, and that was the most meaningful procedure I've ever really kind of been part of. It's not like the craziest procedure.
Yep.
It just meant so much for me, especially at
Yep.
that point in my career. I was like I think
Absolutely.
I must have been a chief resident at the time. It was very special to do something like
Absolutely. Okay, so we're moving towards the last part of our interview. My second last question to you is, what would your advice be to aspiring maxillofacial surgeons? Just briefly, what would your advice be to them?
that. I would say find your passion,
Hmm.
specifically within this specialty. Find your passion, and focus on that, and build that, and go towards that. And that's what that is. That's what I would say.
Perfect. Perfect. Okay, so and any last words for this startup of ours and any advice that you would like to give us?
I think if you listen to me, and you ever watch what I'm doing, you
Yeah.
know that for me it's all about really just doing what you love,
Yeah.
becoming exceptionally good at it, and just spreading love all the time. And that's really what
Absolutely.
it is. Just do what you
Absolutely.
love and love what you do. That's it.
That is beautiful. That is beautiful, sir. Sir, thank you so much for this amazing and informative interview. It really meant a lot to us for taking time out from your busy schedule. I'm sure you've been busy with all the reopening of the dental setting. Thank you so much. Thank you very much.
It's my pleasure. Thank you very much. Good luck with everything and anything you need. Anyone needs anything, text, call, whatever. I'm here.
Thank you. Thank you so much, sir. Take care and stay safe.
Take care. You too. Be well.